You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, the opioid crisis is still taking lives. What will help?
He had to have his entire large intestine taken out. And we went home with 90 Oxycontins. He was devastated and became addicted just with that one prescription.
But first, have we been relying too much on medication?
I love much of what we have to offer in conventional medicine. It's often too heavy-handed for many of the common problems that people are living with.
All that and more this week on In Good Health. If you have a chronic condition or a parasitic infection, there's a medication that can help. Even preventative measures, like vaccines, have saved thousands from diseases that were once a sure death sentence. But this pharmaceutical approach is no longer used only for serious illness. Whether you're tired, have a headache, or need to lose weight, there's a pill for that. But have we become too reliant on the pharmaceutical industry to fix all of our problems?
To me, it makes sense why we came to this deep love affair of conventional medicine. And we don't want to throw the baby out with the bathwater. That's why I do integrative medicine, because I love much of what we have to offer in conventional medicine. It's often too heavy-handed for many of the common problems that people are living with, which are better addressed through diet, lifestyle, exercise, stress management.
That's Dr. Teroni Lodog, a globally recognized expert in integrative medicine. This approach combines conventional medicine with more holistic therapies like acupuncture, meditation, and herbal remedies. She says a key component that's missing from modern medicine is the relationship between doctors and patients. The standard 15-minute visit can't paint an accurate picture of a person's lifestyle and habits. At a minimum, Lodog says this time needs to be doubled for each patient.
Even 20 minutes feels like a luxury, but 30 minutes for many of these more complex patients, it gives us time to be able to talk about diet, ask them how they're sleeping, how they're managing their stress, what are their personal health goals, what is important to you right now. And that is hard to do in a 15-minute visit. And in that 15-minute visit, when you don't have time to ask a lot of these other things, it becomes very easy to pull out the prescription pad and write a prescription. It's not just doctors, is what I'm trying to say. Most doctors are just trying to do the very best they can, but it's a system itself which is designed for acute care management and is really ill-equipped in its current model to deal with more of the chronic problems people are living with.
Part of the integrative medicine approach is treating diseases that occur because of lifestyle factors by making lifestyle changes. Of course, certain medication can be helpful, but they shouldn't be our first line of defense. For example, people with type 2 diabetes often have metformin as the first medication prescribed to them. Dr. David Katz is a specialist in preventative medicine and public health with an expertise in nutrition. He believes a huge problem with the health of Americans is the lack of balance between exercise and diet.
The prevailing lifestyle in the United States is deficient in physical activity and excessive in food. But if we look at the food side, we basically have C's of excess. So excess calories, excess saturated fat, excess sodium, excess added sugar, excess refined carbohydrate, and a vast excess of junk where food ought to be.
Many of the processed foods we eat leave us without the key nutrients our bodies need to function, like fiber, potassium, and antioxidants. And while dietary supplements are a great resource, Katz says we should first look to change the foods we eat before adding another pill into our lives.
We could focus on lots of different nutrients that would benefit health, or we could just focus on the foods. And I recommend the latter, because if you get the foods right, the nutrients sort themselves out. And if you focus on any number of nutrients but don't get the foods right, you're still going to be missing out on something really important.
That doesn't mean that dietary supplements are completely off the table. In fact, Katz says that this kind of all-or-nothing thinking can be harmful to our overall health. The key is using supplements on an as-needed basis. Focus on eating nutrient-dense foods, then add in the ones that are harder to get from your diet, like vitamin D. The amount of vitamin D you need will change based on where you live and the time of year. Katz takes more in the winter, but may not take any if he's vacationing at the beach. And though almost everyone could benefit from more vitamin D, your gender and age can determine which vitamins you may need to add into your diet. For example, women have much different health risks than men.
We're more prone to depression than men. We're far more prone to autoimmune disease. We're more prone to osteoporosis, right? We're more prone to hypothyroidism. There's many, many things that women experience that maybe we're less aware of that are different than what men experience. So when it comes to supplementation, some of the big ones here are ensuring that during our time that we begin menstruating until either, we cease menstruation naturally or we have a hysterectomy, is that we're ensuring that we're getting adequate iron.
Having an iron deficiency can cause extreme fatigue, shortness of breath, and can interfere with your body's ability to regulate temperature. Low Dog says women are most at risk of this during menstruation and pregnancy.
A basic multivitamin with iron is a very wise thing for women to do. If you are at a place in your life that you could be pregnant, making sure that that multivitamin contains adequate amounts of folate or folic acid is also really important because you need that on board before you're pregnant.
When you're thinking about which nutrients to add into your diet, it's important to understand which vitamins and minerals work well together and which don't. Calcium, for example, needs to be taken with vitamin D.
You need vitamin D to absorb the calcium in your diet. And we know many, many people, men and women, are low in vitamin D. But because women are more likely to develop osteoporosis, ensuring that you're getting enough vitamin D so that you can absorb the calcium and get that into your bones is important. So many women I see today, their dietary calcium intake is maybe 450, 500 milligrams instead of 1,000. And it's because we don't drink all the dairy that we used to, or maybe eat all the cheese that we used to. We like almond milks and other milks that may or may not have that amount of calcium in them.
So taking a supplement can help maintain bone strength. But once vitamin D helps your body absorb the calcium, how does it know where to go? Low Dog says that's where vitamin K2 comes in.
Vitamin K2 acts almost like a traffic cop, if you will, directing the calcium in your blood to go into the bone instead of laying down inside of your blood vessels or your kidneys. So if you're taking a multivitamin, try to look for one that has vitamin K2 in it, or take a calcium, vitamin D, and K2 supplement separately so it's all together.
However, you need to be careful when mixing calcium and multivitamins that have a lot of iron, because the extra calcium will block the iron from being absorbed.
That's why you'll often see calcium supplements taken separately from your multi, because it's a big, you're talking hundreds of milligrams of calcium and you're talking 18 milligrams of iron, very small. And a lot of these micronutrients compete for transportation outside of your intestines. And so you don't want your calcium to be taken at the same time as your iron. Also, just like it can interfere with the absorption of some other vitamins, it can also interfere with the absorption of a number of medications, prescription medications. So it's best to take your calcium 2 to 3 hours apart from taking your other medications. So if you take most of your medications in the morning, you can take your calcium in the evening so that there's plenty of space between them.
One nutrient that you may be surprised to hear most Americans don't need to supplement is protein. Kat says it's really only a concern for older men.
So for the most part, we eat too much protein. Almost no Americans are protein deficient, and it's not doing us any favors. It's almost unheard of in the US outside of burn units and the intensive care unit. But the healthy range of protein intake does shift over the life cycle. And men who are trying to hang on to lean body mass, and that is important, and retain muscle, which is important for functional ability, may want to be more attentive to their protein intake, quality and quantity as they age.
Katz is experiencing this firsthand. As he's gotten older, he's noticed that his muscles aren't responding to exercise like they used to.
And these are hormonal effects and age-related effects, and we can combat them to some extent, but we can't not age. And there is an argument then that a slightly higher intake of protein and a good distribution of essential amino acids is especially helpful to men after they hit 50. And from personal experience, I would say even more so after you hit about 60.
But for everyone else, Katz says society's current fixation on protein is misplaced. Instead, he thinks both men and women should be focused on getting enough fiber.
Almost all Americans are massively deficient in fiber, and that's extremely important. There are two kinds of fiber, soluble and insoluble. The insoluble fiber is crucial for the health of the gastrointestinal tract, and one of the disturbing trends we're seeing in the US today is colon cancer at ever younger age. So gastrointestinal disorders are rampant, whether it's inflammatory bowel disease or irritable bowel syndrome or colon cancer and other cancers of the gastrointestinal tract. But part of that is we don't get nearly enough fiber, which feeds the microbiome, keeps things moving through the GI tract.
On the other hand, soluble fiber plays a completely different role, but it's just as important. It dissolves in water, specifically in your GI tract, and creates a physical barrier. This barrier slows down the process of nutrients being absorbed into the bloodstream, which reduces certain responses like insulin production.
So if your diet's high in soluble fiber, you need much less insulin to maintain a healthy blood sugar level than if your diet's low in soluble fiber. And type 2 diabetes and insulin resistance and metabolic syndrome, all conditions related to needing lots of insulin and not being able to produce enough, these are all epidemic. In fact, they're pandemic. These are massive problems all around the world. And there's a remedy available to all of us in the food supply, and that's a higher intake of soluble fiber.
This is just one example of how integrative medicine looks at the full picture to treat chronic issues instead of using medication to spot treat the symptoms. And just like how modern medicine branches off into various specialties, Low Dog encourages patients to build a team of professionals who can help treat their bodies as a whole. You can find more information about Dr. Teroni Low Dog, Dr. David Katz, and all of our guests on our website,
ingoodhealthpodcast.org.
Our writer-producer is Kristen Farah. Our executive producer is Amira Zafari. I'm Elizabeth Westfield.
Coming up, a new position in hospitals that could save lives when In Good Health returns. Cami Wolf-Rice is no stranger to hospital waiting rooms. Her son, Christopher, was diagnosed with a colon disease as a young boy and was in and out of the doctor's office for years. As a senior in high school, Christopher underwent a procedure to have his entire large intestine removed.
And this is right when Purdue Pharma came out with the wonder drug, Oxycontin. And so we didn't know. I mean, we just listen to doctors, right? We don't think about asking questions. And we went home with 90 Oxycontins. And now looking back, he was devastated and became addicted just with that one prescription.
Christopher went on to struggle with opioid addiction for years after his surgery. Rice says they weren't taught the dangers of these drugs or how to safely taper her son off when they were no longer necessary. At the age of 32, Christopher died from an overdose. Rice decided she couldn't let the cycle continue and rip apart another family, so she created life care specialists.
It really was about taking my pain and turning it into purpose. And that's really what's helped me grieve the loss of my son, is being able to provide everything that he did not have when he had a health crisis and that I didn't have as a caretaker. I'm really just trying to help other people from going through the pain that I've gone through. The whole idea, though, is to prevent addiction, right? To stop it before it starts, because many times addiction starts with that first prescription. And we went into orthopedic trauma because that's usually the first place a young person is introduced to opioids, by a gymnastics injury or football injury, a car accident, something like that. And then it literally, their whole trajectory of their life can turn a different way.
Rice realized that we have coaches for everything from sports to investing, so why don't hospitals have a position solely dedicated to getting patients through a health crisis?
You need a coach to help you get through and to educate you and to help you manage your pain and your anxiety and your stress and your depression. And nurses don't have time to do that. And so I built this position based on everything that Christopher didn't have. And then I was fortunate enough to meet Dr. Mara Shanker, the chief of surgery at Grady. And, you know, you have to have a champion in a hospital. And she literally, we became locked and loaded. And we did a clinical trial for 2 years. All through COVID, we were able to continue our trial. And now we're expanding. I mean, it's really taking off because it's a missing piece on the healthcare team.
Grady Memorial Hospital, where Dr. Mara Schenker is the chief of orthopedics, was ground zero for this new program. Schenker says she's in contact with the care coaches nearly every day.
My vision truly aligns with Cammie's vision. When we thought about this 5 years ago, she came at it from the perspective of a parent who had a son who was in the hospital. And I come at it from the perspective of being a physician who wants to help, but may not necessarily have the resources. And the two combined became this concept of the care coach.
At Schenker's hospital, the care coaches are on her floor to help the orthopedic trauma patients. They provide information about opioids and how to safely use the drugs to manage pain. Though it may seem hard to believe given the rates of opioid use in America, Rice says some people don't have any knowledge about the prescription medication.
Many patients don't even know they're taking an opioid or what an opioid is. And we do follow up with patients, which is so critical to make sure that they're off of. Sometimes you have to be on an opioid, but the key is getting off of the opioid and in timely fashion. And we talk about the side effects. And so we try to give alternatives to things that you can do for pain besides taking that pill.
Which Rice believes can save lives, especially since 1 in 4 patients using opioids as a long-term therapy end up with an addiction, according to the CDC. Unfortunately, many addictions end in death. In fact, 76% of all drug overdose deaths in 2023 involved an opioid, which is 1% higher than 2020.
One thing that we were hoping to do with this is to decrease reliance on pain medications. So when I was in medical training, we were told, somebody has pain, how you treat pain is with a pill. And this is, relatively recently that I trained, but even in the last, 20 years since I graduated from medical school, things have changed so much with the opioid epidemic. And so, goal number one was to decrease reliance on pain medications. But the flip side of that is, well, how do you treat pain if you're not using medications? And that was something that we were never trained in. And so they also help people with other strategies for coping with pain.
These strategies include meditation, mindfulness, and breathing exercises. And though opioids are certainly powerful agents to get rid of pain, these alternative options don't carry the threat of addiction.
We do music therapy. We do sleep therapy because so many patients have a hard time sleeping in the hospital, and sleep is such a key component to healing. So we have all kinds of tools in the toolkit, but they also do an assessment of the patient because it's not one size fits all. What helps me might be very different than would help you when you're in pain. So you really have to assess the patient to understand what's best that's going to help them get through that time.
And sometimes having an individual assessment is valuable for more than just pain management. Schenker says the care specialists are often able to notice underlying issues that would usually be overlooked in the hustle and bustle of any hospital.
So sometimes patients come in with a history of alcohol misuse or other substances that we would have never found out because they come in with a broken leg and we treat their broken leg and that's it.
But with care coaches, these patients can get additional resources within the hospital for substance use disorders or mental health issues. This new position does take some responsibility off of the doctor's plates, but Schenker says it helps out the nurses most of all.
Nurses are the ones who are seeing them all the time while they're in the hospital, and this gives them some out other than a pain medication and someone to help them manage patients who are in pain. And then really it's a new role because it provides other strategies for coping with pain that have never really existed in the inpatient setting before.
Rice says that one of the most valuable parts of care coaches is their ability to give patients comfort and a listening ear while in a space that always seems to have an emergency going on.
People are coming in and out of the hospital. They're poking you. They're doing all these things. We're not there to hurt, harm. We're there to just care for that patient, to set them at ease and to help with the fear and the anxiety.
Since the inception of Rice's idea nearly 7 years ago, Care Life specialists have expanded into rural areas, the sickle cell community, and have goals to move into emergency departments. On top of creating these coaches, Rice details how addiction has affected her own life in her book, The Flight, My Opioid Journey.
And I wrote about my journey, but it turned into so much more because it helps the reader understand their own journey, because eventually somebody's going to get sick in your family or you will. Unfortunately, that's life. But it's also just about forgiveness and compassion. And I talk about a home invasion that I had and how you keep hope and you keep flying on that journey, because ultimately every family knows one person struggling with self-medicating. And stop the stigma.
All of the proceeds from Rice's book go towards getting more life care specialists in hospitals around the country. The Flight is available now wherever books are sold. You can find more information about Cami Wolf-Price, Dr. Mara Schenker, and all of our guests on our website, ingoodhealthpodcast.org. This segment originally aired in February 2023. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Medical notes this week. Does chronic depression run in the family? Researchers aren't sure why some people have brief episodes while others experience years-long depression. However, new research published in JAMA Network uses a novel MRI technique that could help find some answers. The imaging measured a patient's lifetime accumulation of neuromelanin, which can help them estimate the same levels of dopamine. It reveals that low neuromelanin is related to chronic depression. Young women with brief periods of depression showed normal levels of neuromelanin. Will we ever truly get rid of forever chemicals? These synthetic chemicals are in cooking pans, waterproof clothing, and food packaging. They're hard to remove and destroy once they're in the environment, and our current removal technology is slow and inefficient. Thankfully, a new innovation published in Advanced Materials removes large amounts of forever chemicals from water within minutes, about 100 times faster than commercial filters. Have you taken a deep breath today? Research in the journal Science Advances reveals that sighing can help your lungs work better. The lung surface is covered in a fluid that reduces surface tension, making them more flexible. It consists of several layers, and a deep sigh is needed from time to time to restore the fluid's correct layering and improve breathing. And finally, a new understanding of video game addiction. New research in JAMA Network Open counters the common belief that video game design is to blame for teen addiction. Researchers discovered that kids who showed depressive symptoms and social issues were more likely to have addicted gaming behaviors. This work reveals an underlying issue that could help guide better treatment strategies. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.